Introduction to coronary artery disease. Coronary artery disease, also called CAID, occurs when plaque builds up inside the coronary arteries. Plaque is made of cholesterol, fat, calcium, inflammatory cells, and fibrous tissue. Over time, plaque narrows the arteries and decreases blood flow to the heart muscle. The client may experience angina or myocardial infarction. Example: imagine a water hose slowly becoming clogged with dirt and debris. Less water flows through the hose. The same process occurs in coronary artery disease when plaque narrows the coronary arteries. Coronary artery disease risk factors. Modifiable risk factors include smoking, hypertension, diabetes, obesity, stress, sedentary lifestyle, lack of sleep, and elevated cholesterol. Non-modifiable risk factors include age, sex, family history, race, and ethnicity. Impact on overall health: CAD decreases oxygen supply to the heart muscle. Clients may experience chest pain, myocardial infarction, heart failure, and dysrhythmias. Mental health disorders such as anxiety and stress may worsen cardiac disease. Clinical presentation: stable angina occurs with activity and improves with rest or nitroglycerin. Unstable angina occurs at rest and may lead to myocardial infarction. Symptoms include chest pressure, tightness, diaphoresis, nausea, fatigue, and pain radiating to the jaw, neck, back, or left arm. Atypical symptoms: women, older adults, and diabetic clients may have atypical symptoms including fatigue, weakness, nausea, indigestion, or shortness of breath without severe chest pain. Coronary artery disease lab studies: troponin I and troponin T identify myocardial injury. CKMB helps identify reinfarction. LDL is bad cholesterol because it contributes to plaque buildup. HDL is good cholesterol because it helps remove cholesterol from arteries. C-reactive protein is an inflammatory marker associated with cardiovascular disease. Diagnostic studies: ECG records the electrical activity of the heart. ST elevation in 2 contiguous leads may indicate STEMI. ST depression or T-wave inversion may indicate ischemia. Cardiac catheterization is the gold standard for coronary artery disease. Stress tests evaluate blood flow during exercise. Chest X-ray may show cardiomegaly or pulmonary edema. Role of the nurse: the nurse should assess chest pain, lifestyle habits, smoking history, diet, stress level, family history, medications, and chronic diseases. Teach clients about smoking cessation, exercise, healthy diet, blood pressure control, diabetes management, and medication compliance. Nursing process recognize cues including chest pain, shortness of breath, diaphoresis, nausea, edema, and palpitations. Analyze ECG findings and cardiac laboratory values. Remember, time is muscle. Restore blood flow to the heart quickly. Place the client on cardiac monitor. Obtain a 12-lead ECG. Start IV access. Administer medications and monitor vital signs frequently. Treatments and therapies: lifestyle modifications include smoking cessation, heart-healthy diet, exercise, weight reduction, stress management, and adequate sleep. Angioplasty opens blocked coronary arteries using a balloon and stent. CABG surgery bypasses blocked coronary arteries. Cardiac medications: ACE inhibitors lower blood pressure and decrease workload on the heart. Beta blockers slow heart rate and reduce oxygen demand. Calcium channel blockers relax blood vessels. Nitroglycerin dilates coronary arteries and improves blood flow. Statins lower LDL cholesterol. Antiplatelet medications such as aspirin and clopidogrel prevent clot formation. Heparin is an anticoagulant used during acute coronary syndrome. Final nursing priorities: recognize chest pain early, monitor ECG and cardiac enzymes, administer medications safely, educate clients on risk factor reduction, respond rapidly because time is muscle.